Hello and welcome. Have you ever experienced persistent stomach discomfort, bloating, or nausea without a clear medical explanation? You might be dealing with functional dyspepsia. In this video, we'll explore what this condition is, its causes, symptoms, and how it's managed. Unfortunately, pinpointing the exact cause of functional dyspepsia is a challenge. It's not typically linked to structural abnormalities in the digestive system. Instead, a complex interplay of factors is believed to contribute. These can include increased sensitivity to stomach distension, altered gastric motility, meaning the stomach muscles don't contract and relax properly, infections like Helicobacter pylori, and even psychological factors like stress, anxiety, and depression. The pathophysiology of functional dyspepsia is multifaceted and not entirely understood. One leading theory involves visceral hypersensitivity, where the stomach nerves are overly sensitive to normal digestive processes. This means even small amounts of food can trigger pain and discomfort. Delayed gastric emptying, where food remains in the stomach longer than usual, can also contribute. In some cases, inflammation, even if mild, can play a role in the symptoms. Functional dyspepsia is a common condition, affecting a significant portion of the global population. Studies suggest that it impacts between 5% and 11% of adults worldwide. It can affect people of all ages, but it's more prevalent in women and individuals with a history of anxiety or depression. Socioeconomic factors and geographical location may also influence its occurrence. The symptoms of functional dyspepsia can be quite varied and often fluctuate. Common complaints include persistent upper abdominal pain or discomfort, a feeling of fullness or bloating after eating, early satiety, feeling full very quickly, nausea, and sometimes even vomiting. Heartburn and regurgitation may also occur, although these are more commonly associated with GERD or gastroesophageal reflux disease. It's important to note that these symptoms are persistent and not explained by any other identifiable medical condition. Diagnosing functional dyspepsia can be a process of elimination. Because there's no specific diagnostic test, doctors typically start by ruling out other potential causes for the symptoms. This often involves a physical exam, blood tests, and potentially an upper endoscopy to visualize the esophagus, stomach, and duodenum, and to take biopsies. The Rome-IV criteria, a standardized set of diagnostic criteria, are often used to define functional dyspepsia based on symptom presentation and duration. Functional dyspepsia is often categorized based on the predominant symptoms. There are two main subtypes: postprandial distress syndrome (PDS), characterized by bothersome fullness after eating or early satiation, and epigastric pain syndrome (EPS), marked by pain or burning localized in the epigastric region, the upper central area of the abdomen. The management of functional dyspepsia focuses on alleviating symptoms and improving quality of life. Treatment approaches are often individualized. Lifestyle modifications can be helpful, such as eating smaller, more frequent meals, avoiding trigger foods, and managing stress. Medications like proton pump inhibitors (PPIs) or histamine 2 receptor antagonists (H2-RAs) may be prescribed to reduce stomach acid. Prokinetics can help speed up gastric emptying. In some cases, antidepressants or therapies targeting visceral pain may be considered. Psychological therapies, like cognitive behavioral therapy (CBT), can also be beneficial in managing symptoms and coping with the condition. While there's no guaranteed way to prevent functional dyspepsia, certain lifestyle adjustments may help reduce the risk or severity of symptoms. These include maintaining a healthy diet, managing stress levels through relaxation techniques or exercise, avoiding excessive alcohol and caffeine consumption, and quitting smoking. Addressing underlying anxiety or depression may also be beneficial. The prognosis for functional dyspepsia is generally good in terms of overall health, but the condition can be chronic and significantly impact quality of life. Symptoms often fluctuate, and complete remission is not always achieved. Research is ongoing to better understand the underlying mechanisms of functional dyspepsia and to develop more effective treatments. Recent advances include exploring the role of the gut microbiome, investigating new medications targeting visceral pain, and refining psychological therapies to better address the emotional and behavioral aspects of the condition. Remember to always consult with your doctor for the best approach.